Councilmember Tyson, Mr. Sims, and to everyone in attendance today. Good afternoon and welcome to Godman Guild, better known as the Guild. We were founded on the belief that we must be, and more importantly, do better for our community, especially our most vulnerable citizens. Since 1898, Godman Guild has worked side by side with primarily Black and immigrant families experiencing generational poverty. Today, just as it was 122 years ago, the concept that no matter your race, gender, or economic status, that we were all born on equal footing, able to achieve that so-called American dream through hard work and without risking life and limb, is simply a myth, one that has only been amplified by COVID-19 and its lethally efficient targeting of minority communities as both a public health and economic crisis. Throughout our 122 years, the work of the Guild has been challenged by previous depressions, recessions, pandemics, and more. Over the past 10 years, we launched 2 business enterprises, which we thought would help to sustain us through the ups and downs of contracts and grants. However, COVID-19 has essentially decimated any hopes of conducting business as usual in 2020, and we have lost the greater majority of our nearly $1 million in actual and projected revenue. What we thought was our safety net is no longer a safety net. And more tragically than that, our community safety net, the human services sector of Central Ohio, is now in need of a safety net. Safety nets all over Columbus and Franklin County are being torn apart while the need for services grows exponentially. I would like to extend a very sincere and heartfelt thank you to Mayor Ginther, Franklin County Commissioners O'Grady, Brown, and Boyce, and to the Columbus City Council. The city's investment of $15 million and the county's investment of $5 million, not only in Godman Guild, but in the over 100 organizations supported through this CARES Act funding, without a doubt, will make a life-saving difference to so many. This support is much more than an investment in our individual organizations. It is a symbol and a signal of hope and belief to those we serve. It is a signal that these individuals and families are worthy of investment and will be supported during every step of their journey to battle the coronavirus. It is a signal that while there has been a dereliction of duty at the highest levels of government, the Central Ohio community is led by individuals who truly believe they are public servants, standing up for the basic human rights of their constituents. Today, I not only applaud these public servants for their support as it relates to COVID-19, but for their efforts to label racism as a public health crisis, to continue advocating and legislating for a minimum wage that is a living wage, for standing up for the rights of women and young families, and for fighting to expand access to voting so that the voices of those we serve, the essential workers, the single mothers, the young people attending underfunded schools, have an equal say in electing the local, state, and federal leaders on whom their livelihoods depend. However, please realize the work is not done. I'm here today representing the Guild and the many hundreds of individuals and their families that we serve. We consider ourselves very fortunate to be the recipient of the limited funds that was available to our sector. The $20 million in CARES Act funding you were able to distribute represents just a fraction of the over $90 million in asks that came from over 200 of our fellow human service sector organizations. I urge you to continue advocating and fighting on behalf and by extension for the hundreds of thousands of individuals who need our support every day. I urge you to be unrelenting in advocating for the continued investment of state and federal funds into our sector, not only to meet the needs of lost revenue, but to address the increased needs for the vital programs offered to our most vulnerable. While the challenges, both known and unknown, are many, my spirits are lifted, knowing that we are in this fight together. Together, we will ensure that Columbus and Franklin County serve as a testament to the success that can be achieved through leadership, collaboration, and shared goals. And so, thank you very much for your time and attention today. And now it is my distinct pleasure to introduce the Mayor of the City of Columbus, Mayor Andrew Ginther.
Thank you, Ellen, and thanks for hosting us here today, and thank you all for joining us. To Councilmember Tyson, President O'Grady, Elon Sims, and Ellen, and your entire team at Godman Guild, we can't think of a more appropriate place to make this announcement here today. As you all know, when COVID-19 first hit our community in March, we knew we would need to address it in three key areas: public health, preventing deaths; human services, providing basic services to residents, to our neighbors; and economic recovery. All of these are intertwined, and we continue to battle on all fronts. Today, I'm happy to stand with my colleagues to announce grants for the human services sector. Along with the county, we're putting forth a total of $20 million in CARES Act funding from the U.S. Treasury, monies that were allotted to us to help offset the impact of COVID-19 on our community. We all know about the public health impact. More than 25,000 people in our county have been infected, 25,000 of our neighbors. 2,000 have been hospitalized, and 600 of our neighbors here in Franklin County have died. The economic impact is clear as well. Unemployment is almost 10%, and sadly, many businesses have closed. The human services impact is just as grim, with so many of our neighborhoods struggling with the basic needs of housing, food, and childcare. And we know that our minority community has been more drastically impacted by the pandemic on all fronts. So we've approached all of our work to alleviate suffering and provide support with an eye toward recovery, dynamic, inclusive recovery, through an equitable lens. Friends, we will not be able to recover fully from the crisis if we do not recover equitably. So today, we are announcing the recipients of the Human Services Grants, 110 entities in total. These grants were given to organizations across many sectors, including youth, seniors, families, veterans. We were able to leverage City Cares dollars because of the great leadership of the county commissioners, assuring that we could have a greater impact across the community. And all of the work we do at the city requires collaboration internally, as well as with great partners at City Council. I couldn't ask for a better partner in the work of human services and great public health work. We have an incredible advocate. Please welcome our great champion, Columbus City Councilmember Priscilla Tyson.
Good afternoon. First, I want to thank Ellen Moss Williams, President CEO of Godman Guild, the Guild, for hosting this announcement today. The Guild, true to its mission, provides programs that enhance the social and economic mobility of individuals and families in the Wyland Park community, but also throughout Central Ohio. I want to also recognize our mayor, Mayor Andrew Ginther, and Council President Shannon Hardin, for their work and understanding of the importance of getting these dollars to our social service organizations. We appreciate the work of the Franklin County Board of Commissioners. The county's partnership is essential. I'm sorry. The $5 million the county provided allowed additional organizations to be funded. And I would like to thank President John O'Grady and his colleagues. Additionally, I appreciate the Crane Group with the leadership of Elon Sims joining us to be a part of a rigorous selection process. As chair of Columbus City Council's Health and Human Services and Workforce Development Committees, I understand that COVID has impacted every facet of our community, every facet. The pandemic has caused unforeseen needs amongst Columbus and Franklin County residents. In addition, human service organizations working to meet those needs have also been impacted by unseen and unbudgeted costs. As a result, many residents and nonprofit organizations are experiencing economic instability. It is essential for the City of Columbus to invest in ways that increase their resilience and stability. The Resilience Initiative was implemented to increase the capacity of human service providers to recover quickly and meet the increasing demands of residents for goods and services. To support the city's regional vision for economic security and resilience for all, the city, again in partnership with Franklin County Board of Commissioners, conducted a competitive grant funding process from July through August of 2020, from which the city and the county received 247 proposals representing 247 agencies for a total of $91 million. $91 million. That shows the need in this community. In addition to assessing the increased expenses and losses incurred by these agencies, grant reviewers also considered which agencies provide direct services to assist populations that may not otherwise be served if the agency did not exist. Considerations were given for race, as it's always been said today. Certainly, Black and brown people have been affected by COVID more so than others. Gender, ethnicity, age, LGBTQ, and others, and zip codes that we need to be always concerned about. Reviewers were asked to consider if agencies provided direct services to vulnerable populations and or communities highly or disproportionately impacted by coronavirus. From the proposals that were submitted, 110 agencies were selected. 80 agencies will enter into agreements with the City of Columbus and 30 with Franklin County. At this evening's council meeting, I hope my colleagues will support me in passing legislation to provide funding to these organizations that have been selected for the resiliency grant funding. There's a lot of diversity in the organizations being funded, and the mayor stated some, and the types of services being offered. These agencies being funded represent basic needs. Food, housing, youth programs, medical and mental services, just to name a few. I want to point out that these organizations were able to retroactively apply for this funding dating back to March the 30th. And these funds have to be spent by November 30th. However, we understand that this pandemic is not over, and it will continue to cause economic hardship. The Human Services Chamber of Franklin County estimates that Health and Human Services has lost over $40 million since March. So we must continue in our efforts to advocate for additional dollars to support our community organizations. As I close, I want to recognize the Mayor's Deputy Chief of Staff for External Affairs and Director Mike Stevens and his team in the Department of Development for their commitment to getting us to where we are today. and the committee that worked on this. And finally, I want to let our nonprofit partners know we appreciate what you're doing for our community and its residents. It is only appropriate for me to say thank you for standing in the gap. Standing in the gap. We recognize that many of you continue to operate even in the face of lost revenues and increased expenses. So again, thank you to the agencies in these difficult times. And now it is my pleasure to introduce President John O'Grady, who is the chair, who is the president of the county commissioner, and just to say that John truly does care about Columbus, Franklin County, and certainly all the individuals being impacted by the human service funding. President O'Grady.
Well, thank you, Ellen, to you and the folks at the Guild for hosting us here today and arranging for this fantastic weather. Thank you to Mayor Ginther and the Councilwoman Tyson, our partners at the city. Thank you to Elon Sims from the Crane Group for all the work that you've been doing with this as well. Hello, and thank you to everybody for having me here today. I want to take a minute to share how thrilled I am to know that the nonprofits who care for so many here in Franklin County will receive help that they so desperately need. As you know, you may know, the Franklin County government provides or is the fiscal agent for a majority of the social services that you see throughout Franklin County. My colleagues, Marilyn Brown and Kevin Boyce, and I are very proud to always have taken great pride in being able to ensure that these programs are available to serve as a safety net for most of our vulnerable residents. However, the demand agencies have seen since the start of this outbreak has been unlike anything most of us have seen or faced in our lives. County and city officials knew something extraordinary had to be done. That's when we began working collectively to find more financial help. This $20 million in CARES Act funding that nonprofits are receiving today is a significant amount, and it will help families stay in their homes, keep food on the table, and it'll help all of us to manage our mental health. But I wish we could do more. Every year, Franklin County has nearly $750 million in expenditures in the areas of health and social services. That's $750 million, and yet $750 million is the typical amount given yearly before the pandemic. It was just the amount needed before Ohio experienced unemployment claims this year that are greater than all of 2017, 18, and 19 combined. And that was the basic amount that was needed before 25,000 plus people battled the coronavirus here in Franklin County. Sadly, still 1 in 4 children in Franklin County lives in poverty. We'll get through this, and a time will come ahead better in the end, we'll get through this and come ahead better in the end because we work together. County agencies like the Franklin County Department of Job and Family Services and Franklin County's Office on Aging work with many of our grant recipients that are a part of this. They're some of the recipients today, and they help us day to day, and they'll help us get past this virus. We all know too well that this pandemic is unlike anything that our country has faced in 100 years. So before I leave this podium, I want to make an ask of all of you. If your family's living on the same budget that you had last year, consider yourself lucky. If your family is living on that, you should consider yourself lucky. This is $20 million being awarded today that will help, but unfortunately it's not enough for everyone. So I ask that you take a minute this week to look for your neighbors and coworkers, those that are more vulnerable, those that are less well off, and see where you can help. This pandemic is bigger than any of us, and the need is greater than we can fathom. But I believe we succeed when we all work together. So thanks everybody for being here today. I'd like to welcome at this time Elon Sims of the Crane Group, Chair of the Application Review Committee, to the podium. Elon.
Good afternoon, everyone. Thank you to Mayor Ginther, Councilmember Tyson, members of City Council, Commissioner O'Grady, and the Board of Commissioners for your work to encourage and support the human services community and its efforts to meet the needs of vulnerable individuals and families across this community. I'd also like to thank Director Mike Stevens of the Department of Development for this unique opportunity to serve as chair of the Resilience Initiative Review Committee. This committee was part of a multi-phase process to expand the capacity of human service providers to meet the increased needs and demands for goods and services for the residents of Columbus and Franklin County. The Columbus and Franklin County Resilience Initiative began with nonprofit organizations responding to an RFP to apply for funds provided through this initiative. Once those RFPs were received, a technical review was completed in order to provide initial funding recommendations, which led to the work of the Resilience Initiative Review Committee. The purpose of this committee was to review funding recommendations by that technical review team and to provide final funding recommendations to the mayor and to the Board of Commissioners. This committee, made up of 9 community members from diverse backgrounds and experiences, was charged to conduct its review with a lens of equity and inclusion, focused on ensuring that the final grant awards provided opportunity for an equitable distribution of services to meet the needs of Columbus and Franklin County residents. I personally would like to thank the following committee members for their service: Habiba Bankston, Pastor Teddy Caesar, Terry Williams Efaduba, Brandy Slaughter, Tiffany Wright. We had staff support from Chris Maitland, Dana McCurry at the county, Almar Walter, and Kim Stans. Coming into this important work, each of us understood the impact that this pandemic has had on the human services organizations and the community at large. As has already been shared, this was evident by the 247 proposals received that amounted to over $91 million in requests. Throughout this entire process and through the work of this final review committee, we relied on a set of core values and guiding principles. Those were to build upon strategic investments in the human services sector, produce results that aid in long-term recovery efforts, and provide service and equity to all patients, clients, customers, consumers, and service users in our human services system. This lens of equity in our work allowed us to ensure that we closely reviewed agencies who applied, the populations that they serve, the specific services and programs they deliver, where they provide these programs and services, when they offer them, how they provide them, and the capacity of these organizations to continue to serve all segments of this community during this time. Admittedly, this was not an easy task. However, we began with working to define our goals, which included the ability to use these resources as a way to ensure that as many people in our community as possible could get access to the goods, programs, and services of these organizations, despite where these folks live, their race, their gender expressions, their religion, nationalities, sexual orientations, their abilities, or their age. As a result, 110 organizations, both large and small, are represented as part of these funding recommendations. When we came to the final list of organizations, we saw variety, we saw diversity, and we saw needs being met across this community. Through the funds provided as part of this initiative, we know that a direct impact will be felt in a number of areas: in health, housing, workforce, food access and affordability, mental health, substance abuse, education, violence, community engagement, basic needs. And again, these are just to name a few. My training as a social worker has taught me to recognize the importance for all of us to work together to enhance human well-being and to help meet basic needs of all people. Fundamental to this work is the attention to environmental forces that create and contribute to and address problems in living. This pandemic was surely an environmental force whose effects will be felt for some time. However, what we're seeing here locally is our county and city leadership coming together to ensure that needs are being met in this community and to support an inclusive path for long-term recovery. Mayor Ginther, Commissioner O'Grady, Councilmember Tyson, Director Stevens, on behalf of the committee, we are pleased to have presented you with a very strong list of recommendations. Thank you again for this opportunity to serve, and thank you to our nonprofit community who has continued its commitment and serving this community during these difficult times. Thank you so much, and I welcome Mayor Ginther back to the podium.
Thank you, Elon, to you and your colleagues. Outstanding work. We're proud of the work that's been done. We'd be remiss if we didn't acknowledge our Congresswoman Joyce Beatty and our two U.S. Senators, Rob Portman and Sherrod Brown, who helped make the CARES Act possible and have continued to help work with us for additional flexibility for these funds so we can get them to people who need them the most during this crisis. But it also reinforces the need for more. These CARES Act dollars will run out, and clearly the needs, the fact that we're awarding $20 million today and there were $91 million worth of requests, the needs are still great, and our neighbors are going to need our help in investing in their quality of life in 2021 and beyond. So I want to encourage our partners in Washington to do the right thing and put people first. I will say again that we're not out of the woods in our fight against the pandemic, far from it. But through these grants, we will be able to make progress to rebuild across our human services sector. Be happy to take questions from the press. We'll also make sure we'll make ourselves available. I guess I speak for the other speakers. We'll make ourselves available for a few minutes, but not too long, because Councilmember Tyson's got a council meeting here in a little while. Any questions from the press for me or other speakers? We'll stick around for a few minutes if you have any one-on-one, but thanks for joining us.